Hi, everybody. I know I promised you this on Sunday, but I've been battling an awful cold. What my intention is to show you how to formulate these case studies into a SOAP note format. This is how I want you to proceed starting week 3. Okay, so starting on week 3, let's look at the components of a SOAP note. And I have sent you some presentations, so you should have a general understanding of what I'm looking at here. You've got S for subjective, O for objective, A for assessment, and P for plan. So we have the 4 components of a SOAP note. Now let's look and see how each one of those is going to fit into our clinical case study. So let's look at the SOAP first. This is your subjective information, and this is going to be really helpful for you when you move on down the road and you're doing your clinicals, because this is how you formulate a history on a patient. So the first thing that you want to get on your patient is a CC. So when you're listening to the videos, the chief complaint consists of 1 or 2 words that describes what brought the patient in. So when you're looking at your videos, it might be diarrhea, it might be, I'm trying to think of what some of the other ones are, fever, whatever brought the patient into the clinic that day. So that's the chief complaint. Very important, not only in the diagnostic process, but in the billing process. You cannot bill a chart for payment from an insurance company unless you have a CC present. Now, the next component is going to be the HPI, or the history of present illness. Now, I want you to go into more depth. So this can be a paragraph in length. And what you're going to do with this paragraph is go into more depth as to what the patient is here for. So when you're doing the HPI, look at that old mnemonic called old carts, and use old carts when you are formulating your HPI. The reason I say this is because it'll help prevent you from missing pieces. So when you're looking at old CART, it's an acronym. So onset, location, duration, characteristics, aggravating factors, relieving factors, and treatment. So how do we take old CARTs and put it into our HPI? Well, I want to know where that main complaint is coming from. And I like to usually use the old sore throat because I see so many sore throats. So the first one is onset. So you can say 3 days, sore throat pain. And so we've got the O and the L. And the duration. Onset. Was it sudden? 3 days sore throat, gradual onset. Or it can be sudden onset. I get this often with ear infections where the children have had a sudden onset left ear pain. Okay. The characteristics of it. Is it constant? Constant. Is it throbbing? Is it sharp? Is there anything that makes it worse? The aggravating factors. Often with a sore throat, it's worse with swallowing. Okay. And is there anything that makes it better? Any relieving factors and treatment that you have done? So I can say that I've been taking Tylenol with little relief. Now in here, it's also a good time to do your pain scale. So on a scale of 1 to 10, where would you rate that pain? Oh, it's an 8. Okay. And I always like to ask in my HPI, have you been around anybody that's been sick lately? No recent contact with illness. Sometimes strep's in the classroom, so then that's an issue, and I know that we've got strep. Now let's take this and apply it to your case study. Now I understand that you aren't going to have all of the information to fill in all of these characteristics as we move forward on our SOAP note. So the ones that you do not have, I want you to put like not applicable or not mentioned, something in there. You can leave that blank, because I realize that there isn't going to always be the case studies don't give you all the information to fill in all the blanks. Okay. All right, so now we've done the HPI. Now the next piece is going to be, we're getting some background history. Now, often when you're in a clinical practice setting, this information is going to be performed by the medical assistant or whoever is rooming your patients for you. But in the clinical setting, you should be getting this information, because I've found that obtaining a good history is one of the most important pieces of the process of developing a diagnosis. Okay, so the next one is going to be past medical history. So if the review has, if the clinical case study has any information on past medical history, it will go there. Is there any past surgical history? That would go there. And then I want to know is, is there any family history of illness? Family, I can't spell, of illness. And again, you may not have all of this information here, and that's okay. It's important for you to have a semblance of order, and once you find an order that works for you and that your professor accepts, it's kind of a good idea to hang on to that. That way you know which direction you're going in. Then I always like to know what the immunization status is, especially now that it's flu season. And I want to know if they take any medication, and the dose too, and do they have any allergies to foods or medication. So I want you to try to fill in the blanks here. The next is the review of systems. Now, I want you to be mindful of the fact that your entire note is going to be dictated by the CC and the HPI. So, any system that's been discussed here needs to be addressed in the review of systems. So, we're going to say sore throat pain, anything else that was listed in there. And I always do a general one. I ask them if they've been more tired lately, etc. The review of systems. So now that fills in your area for the S piece of it. So that's the S. All right. So now we're going to O, objective. Now remember, the subjective piece is what you hear. The objective piece is what you see. And it starts out with vital signs: height, weight, temp, and then a blood pressure, pulse, respirations, sometimes an oxygen saturation level too. And then you're going to go through the body systems. You need to, for billing purposes, at least hit on 3 body systems. So go into your text and find a good template for body systems. So in this one, I'm going to say the patient is alert, oriented, times 3, looks ill. Okay. Then, any other body system. The throat. I'm going to mention the throat. What does the throat look like? Is the throat red? Edematous? Is there exudate? I also always check heart, lungs. On a patient like this, you're going to do a regular HEENT exam. And alert, oriented, times 3. That's considered general. And then the throat is red. Is there exudate? Heart sounds. And I'm going to look at their ears and nose, throat, eyes. So we're going to do this exam because everything is dictated by that very first note. And this particular patient had a sore throat. Now we're going to move on to our next one, which is A, and this stands for assessment. So this is where you're going to put your differential diagnoses with rationale, and you've done a really good job. So we have to, when we choose our differential diagnoses, and you have to have at least 3 to 5, they have to relate to the symptoms and the history that you're seeing. So I'm going to say pharyngitis, strep throat. What other one can I choose? I can choose a what am I thinking? Tonsillar abscess. And then here, I need to write my rationale as to why I think that these fit with my particular patient. And ultimately, you are going to also, in your plan, what type of tests. Whoops, I don't know that one. What kind of tests are you going to run? Any test that you run, I want you to have a little slide and or a little clip of what the normals would be. So in this particular case, I'm going to do a point of care test, point of care strep throat. Excuse me. And if that's negative, I'm going to do a throat culture and come up with my final diagnosis. Okay. Now let's go to the plan, which is the big piece too. What are you going to do? All right, my patient has been diagnosed with strep throat. So I know that for strep throat in children, the positive strep and I am going to prescribe amoxicillin. I'm going to say this is a child. And it's going to be 400 milligrams per 5 ml. And the dose is going to be 50 milligrams per kilogram per day. And I will figure out that dose. So let's say, let me get my calculator here so I can come up with a good case for you. I'm going to say that I have a child that weighs 50 pounds. Translated into kilograms, That's 22.7, so I'm going to say 23 kilograms. Okay. 23 times 50 equals 1150. So that's the milligrams they need per day. And I'm going to divide it by 400 because that is the strength that I'm using. Divided by 400 is 2.875 times 5, because that's the quantity, 5 ml, is 14.3 divided by 2, because we give it twice a day. It's going to be 7.1 or 7 milligrams every 12 hours times 10 days. Okay. I'm just double checking my dose because that's what you'll always do with pediatric patients. You're going to double check your dose because you don't want to make a mistake. I'm so sorry for all that background noise. I'm at the Olivet campus in Oakbrook and they're doing construction upstairs. So it's a nightmare. Okay. So that's the medication that we're going to be giving. And another part of the plan is, what are we going to teach the patient? Teaching is so important. All right, so this is the P continued. When you're teaching about strep throat, you need to let them know they're going to be contagious for 24 hours, so no school. Now, recent literature does say 12, but I'm still going by 24. You need to use Tylenol or Motrin for sore throat pain. I like Motrin because Motrin addresses inflammation that occurs in in the throat too, but that's just with their strep throat patients. Okay, and then they need to get a new toothbrush in 3 days because there also is conflicting research regarding the bacteria being on the toothbrush, but just to be on the safe side, I say go ahead. I also say if family members begin to have symptoms, they should be tested. Advise school of positive strep. And then I also go into when to follow up. Follow up if no improvement. In 24 hours or sooner if symptoms worsen. Okay, now the thing with documentation is that you want to tell a story, you want to paint a picture of what you're seeing, and it's a very delicate slope. Now as a student, it's often more is better because we want to make sure that you have a full understanding of what the requirements are for documentation as a nurse practitioner because they're different. Now, I want you to be mindful of the case that when you get into practice, most of these things are going to be done via the electronic medical record. But the electronic medical record is still set up as a SOAP note. I use Epic in practice, and in my Epic documentation, I have to develop a SOAP note. And it's a lot easier because I'm not handwriting it out. But It's very, very important for you to understand the concept related to SOAP note charting, because this is a very litigious society that we live in, and we need to make sure that you have documented appropriately to substantiate the diagnosis and treatment that you've chosen. Okay, so moving forward, as you start week 3, I want you to try to formulate your note in a SOAP note format. Now remember, you're not going to have all of the information to fill out all of the fields, and that's okay. This is an introduction moving forward, so this will give you a one-up on how to formulate those notes, so that you won't be learning this from scratch when you start your clinical. All right, so please don't hesitate to reach out if you have any questions regarding the development of these notes, and good luck.